I'm definitely going to be having the COVID vaccine when it's offered to me. I believe this is the most safest and effective way for us to get back to how our lives were pre-COVID. The systems that are in place at the minute, so the face masks and the social distancing, they're only preventative measures. They're not really getting rid of the root problem. The only way that we're going to reduce the threat of coronavirus is if we become immune to it, and the safest and most effective way is to have the vaccine. I've typically seen this in my workplace. As I'm a dementia link worker, I have to do home visits to people. There's a lot of anxiety around me coming into their homes, knowing that I could be a carrier. I also don't feel that comfortable meeting elderly people who are vulnerable, in case I'm a carrier as well. The only way to get back to delivering the best care we can is by having the vaccine and not being a threat, and not risking people's lives. There's been quite a lot of fake news and myths. I was previously one of those people. I had heard quite a lot of things on Facebook and social media that I thought, oh, actually, I don't like the sound of that. But I had done my own research and disputed quite a lot of these myths. And that tends to be something that I then say to people. I ask them where they got these informations from. So people are worried that it's been rushed or that they're worried about the side effects. If you actually go and do the research about it, the side effects are so limited. Firstly, you can get side effects from anything. You can get side effects from paracetamol. So my advice giving to staff who are a bit worried about getting the vaccine is just to do your research and not to internalise other people's views or stuff you read that's not on validated websites like the NHS website and the government website. I genuinely can't think of another way of going back to how life was pre-COVID. The measures in place at the minute, they're just preventative. We're going to go in and out of lockdown for years to come if we're not immune, if we don't get enough people who are immune to the disease. It's a never-ending cycle.